Before I get started, what I'd like you to do is close your eyes. Imagine what it would be like for you as a provider if patients ran your hospital. And what would it be like for you as a leader if patients ran your hospital? What would it feel like? Not just what would be different in the day-to-day work, but what would it feel like? Would it be difficult to make the shift from how you work now to that place that you're dreaming about? Or could you pull out from inside of you the very things that drove you to the place that you are today? The reasons why you started to contribute in healthcare as a patient, as a leader, or as a provider. My hunch, as you wake up and join reality, is that while you may have started your dream thinking about a place and set of circumstances that were very different than today, the connection back near the end of asking yourself, does this somehow connect back to why I started all this in the first place, was probably there. Let me ask you, did you experience that circle that I talk about? Yeah. You know, as leaders, and I've been asked to talk about leadership in the journey of being part of partnering with patients and leading an organization through a change where we, frankly, were an organization that was undergoing a great deal of difficulty. We were a place that was characterized by not just the problems that we had that were on the outside, really poor financial situation, difficult and poor patient outcomes and safety, low morale. But there was something inside the place that when I arrived at KGH in February 2009 that was underneath all of that, that was about the way people were feeling. The spirit was broken. And in fact, I found after thinking about my career, and I've led lots of change over time, 4, 5 different mergers, amalgamations, big change. But this was not like the others because people were hurting. There was fear of speaking out about the problems that existed. There was a real lack of sense of where do we go? And in fact, unlike most places you go and in situations like this, you'd expect a lot of chaos. But there wasn't chaos. There was almost like it was still. And that was a bit scarier to me than chaos. And as I started my journey by really trying to understand, I knew how to fix the books, if you will. I knew how to lead efficiency changes. I knew how to mobilize people to address a lot of the tactical and operational problems and challenges that we are facing. But I didn't quite know how to approach mobilizing and thinking about how do I unleash the full potential of the people that are here to move us forward, because what was before us felt daunting. It felt daunting to all of us. And I knew as a single leader coming in, that I couldn't see myself as a single leader. I couldn't see myself and behave in the traditional way of thinking, okay, I somehow have to orchestrate everything to work so that we're all going to go in the same direction and succeed. I had to do much more than that. And I had to tap into the potential of others. I needed to tap into their hopes and dreams for a future that we could create together. So I started to ask people the kinds of questions that I just asked you. What if patients ran your hospital, our hospital? What would be different and why? What does outstanding care always look like? What does it feel like? Describe an experience that you've had, not here, but anywhere, where it was amazing. What happened? And then start to collect those elements and think about how we then turn those notions of experience into something that we are going to work together to create for every person every day. And then a couple of things happen. Because, you know, we're hardwired to think about what do we do for people and what do we do to people. We're hardwired not in healthcare. But as I was having conversations with people in the community and groups of patients, a woman stood up and she said, Leslee, I'm afraid to go to your hospital. And I thought, I can handle, I don't like the food. I can't find my way around. But to be scared to come to the hospital was really something. And it struck at the core for me as a nurse and as a leader. And what made it even more difficult was I heard from staff that they were scared to go under their shift because they were scared about not being able to deliver the kind of care that they wanted to provide and that they knew they should be providing. But they didn't feel that they had all the tools and the supports there in order to make that happen. Every time someone came up with a new idea, it seemed to be put on top of things, but nobody would let go of all the other parts that were still in place. So let's go do this new thing. And they'd be saying, I can't. I just can't. I need to focus on my patients. And then we'd say, well, our staff aren't engaged. And so this is part of the underpinnings of what happens in an organization and a culture. An organization is first and foremost a collection of people. And as I listened to folks, I set out to think about the what if. We didn't think about ourselves as a hospital, but we truly started to think about ourselves as a community of people. Would we behave differently? Would we do different things for and with each other? And if we were truly a community of people that wanted to rally around what I heard people say, which was we wanted to transform the patient and family experience. And there was a lot of thinking around what does that transform mean? What does it look like? What does it feel like? And then I still remember as we engaged about 3,000 people, and I was part of all these discussions because I felt very strongly as a CEO that I needed to be listening myself. I couldn't delegate this to a consultant. I couldn't delegate this to a strategy department. I needed to listen, and I needed to feel the emotion that, frankly, I couldn't shake around hearing some of the things that people were candid enough to tell me. And with that, I remember standing with the board and saying, you know, that our essentially trying to capture our new mission of this, of transforming the patient and family experience. So this is what, and being a community of people setting out to do this. And then I thought to myself, you know, I'm already falling into the trap because we say that we are going to transform the patient and family experience and we're the hospital. But what I've been listening to the past few months wasn't the same. That's really not what people were saying. People all wanted to be a part of it. And that if truly we were going to get at the essence of what people said that they wanted to create, was that we really needed to embrace this notion of doing with. And it couldn't be the board telling people this is where you're going to go and what you're going to do, or the CEO. We actually had to discover where we were going to go and what we were going to do together. There needed to be clarity about the focus. But the essence of what happens in organizations is actually about the ways in which we treat each other. That shapes culture, and how we make decisions. And I thought a lot about culture, because lots of people say as leaders, our job is to go in and change culture. I'm not convinced that that's so. I think we need to understand culture, deep understanding of culture, deep understanding of interactions, and tap into what makes it and shapes it every day. And if you think about decisions, I actually thought that decision making was probably at the heart of something that we could focus on and change. And if we were really embracing this notion, we talked a lot about this nothing about me without me kind of construct. And 7 years ago, not a lot of people were talking about that. But we tried to imagine what it would be like. And so we actually laid down probably the single biggest stake in the ground that we could have. And that really was a defining point for changing everything that followed. And that was the commitment that any decision in our organization where there is a material impact on the experience of patients, a patient will be at the table. Now, at the time, we had no idea how we were going to do this. And that is in itself part of our story. Because we knew that we wanted to go to this place where decision-making on a day-to-day, moment-by-moment basis, at the bedside, with the interactions with providers and patients and the teams and families, nothing about me without me. Any decision where there's a material impact on the experience of patients, a patient needed to be part of that. And so we cultivated there was a whole model, patient and family-centered care around that. That has to be the heart of everything else. And then we also, as we looked at it in the organization, we thought, well, what do we do? What kind of decisions do we make every day? And there are a gazillion decisions that we make every day that impact on the experience of patients that we have no idea what the voice and the perspective of patients really is, but we think we do. And our experience is once we started to open up the conversations and open up the tables, we discovered a whole lot that we never knew before. And in that discovery process, we started to encourage and develop by having patient and family advisors invited to tables where we were actively involving and engaging them in everything as was described, from hiring staff to being part of our infection control committees, to being on our senior leadership teams, that the contributions and that patients were making were changing the conversations. And that people then started to really ask the questions around, as we started to move forward, around, well, what are the leaders meant to do in this situation? And here's where also my whole paradigm of leadership has started to be shaken to its core. Because we've always thought about there's leaders, there's followers, there's leaders, and there's others. I truly believe that the leader's role is to create other leaders. That's the essence of what we do. And leaders connect, we create, we help develop leaders, patient leaders, professional leaders, policy leaders, others. We connect with each other through very deliberate practices that are creating other leaders. And through a collaborative constellation, if you will, of leaders, that's where the magic happens. It doesn't happen from the top down. It doesn't happen from the bottom up. It's happening by the connectivity in these new hyper-connected ways that we are working together. But to be a leader in that kind of milieu is very different than the way that we've been developed before. And so one of the things that we started to do that I'd like to share with you is thinking about, well, what does patient-centered leadership look like? And it might not be the right language as the language continues to evolve around patient-centeredness, but that's where we started. And we started to think about really and truly what can leaders do to help create and cultivate other leaders and build out this environment, this context, the conditions by which partnering and collaborating and sharing care and sharing decision-making with patients can happen. And there's 4 elements to our work around patient-centered leadership. And this is not a masterful theory. There's no Cochrane review of what we are doing, but we are experimenting. And I encourage you to experiment from where you sit as well. First thing, as you go tomorrow and you're out in your environment as a patient, as an advisor, as a leader, as a clinician, look and see what captures your imagination and your interest and your curiosity about something someone's done that has made an impact on the patient experience. Why did that happen? That's so neat. Or, oh boy, I hope that doesn't happen again. What about that situation? Capture that moment. Part of our role as leaders is to identify opportunities where we can tell stories. Because sharing stories is actually part of shaping culture. And if you're sharing stories and not, I saw you do this and this is wrong and now we're going to have a performance review about it, but actually talking about the experience of what you caught someone doing and you observed, sharing that positive or learning opportunity with someone else. Our job is to do that all the time as leaders, moments, and share it in the moment. Ask yourself about the many numbers that you receive in reports. How many people get reports with numbers on them in their daily work? I bet there's more hands. So I get a lot of numbers as a leader too, and they are mind-numbing. And one of the practices we've introduced at KGH is called peopleizing the numbers. And peopleizing the numbers, it's not a real word, it's not an English word, it's just our word. And peopleizing the numbers means literally seeing the patient and the person in the number. It means, we learned this from a patient who was at our infection control committee. There was a very esteemed physician talking about reducing infection rates and by 0.08% and how proud we were. And she said, how many people came to our hospital last month without an infection and left with one because we gave it to them? That is peopleizing the numbers. That is hospital-acquired infection. As a leader now in my organization, I don't look at numbers or respond to numbers unless people can peopleize them. So that's a standard that I've set, and that one that people are still striving to achieve. Because we don't get it right all the time, but we are trying. So peopleizing the numbers. Asking yourself, have you included a patient today? Have you included, if you're receiving a report, you're about to start a project, just have we included a patient today? It doesn't always need to be the person present. It could be the voice in a variety of ways. There's lots of ways to tap into. But have I included a patient today? And the next question to ask, and I will say, have you included a patient today? There isn't an opportunity that we have found where involving and including a patient doesn't add value. Right down to the critical incident reviews, there just is not a circumstance where it doesn't add value. And so and I will share one quick story. As yesterday or the day before, when I was on rounds, and we had a patient in our hospital that potentially was infected with Ebola, and everybody was responding to that circumstance. And when we talked about the debrief, I just asked in terms of what's going to happen next, and people said we are going to debrief, and it was the staff nurse who was in as part of the team who said, and of course we're inviting the patient to be part of that debrief. So to me, this meant that we had moved mountains. We had moved so far. She said that. They identified it right up front as the natural course of things. Of course, that patient would be invited back to be part of that debrief and learning. That's where have we included a patient, I didn't even need to ask. But one of the other questions I do ask on rounds, and that I would encourage you to ask yourself and others around you from a patient-centered leadership perspective, is what have you learned? What have I learned from a patient today? And we overload our managers with so much work that I don't believe adds value to the overall performance of the organization or to the delivery of excellent, exceptional care. But if you ask people, what have you learned from a patient today? And if people cannot ask that, I'd ask you as a minister of health, I'd ask as a CEO of the hospital, as the director of nursing, every position, what have you learned from a patient today? And if you can't answer the question, you're not spending your time in the right place. That is my view. And so in asking ourselves, not what did you do to a patient today, not what you do for a patient, what did you learn from a patient today? Then we really embrace the essence of leadership. Leader is learner. And I think that that is at the core of what we are here for as leaders as learners, and as learners, we will be the ones that will help cultivate the environment and the context for the outstanding care always to occur. I think a little bit in the slide that was that you showed, Carolyn, of all the patients in the image of the animals, of how different everyone is. And I found myself thinking there that really, so what's my job in all of that? Maybe my job is to help create the energy and the focus of folks to help build the ark. Because essentially our job as leaders is to create the conditions under which all of the work that we're talking about here can thrive. And I would say to you that there is no real magic. Don't wait for your senior leader to get on board. You need to be thinking about leadership as an interconnected system of which you are a node of that energy, and you will help your leaders learn. Because I didn't just imagine that we were going to do all this. There were many, many people, and I learned and was helped to realize that this is probably the most important thing that I could contribute to the organization in our journey forward. I'm so incredibly proud of the staff and the many patients and participants in the real transformation of KGH. Do we have it all right yet? No. Are we still learning? Absolutely. Are we making some mistakes along the way? Absolutely. But we didn't have a fine-tuned, over-engineered plan. We got in there and we've been learning and experimenting and living and learning as we go and as we grow. And that would be my encouragement for you. Thank you very much, and all the best on your journey as leaders.